everybody. Thank you all for coming. My name is Jennifer Rodriguez, and I am going to go ahead and talk about breast cancer awareness. Today, we are in the month of October, and breast cancer awareness, we celebrate it in the month of October. Breast cancer is the most common cancer among American women today. El cáncer de seno es el más común cáncer en las mujeres en América, en Norteamérica. Okay, Joy. What is breast cancer? It's the abnormal growth and uncontrolled division of cells in the breast. The American Cancer Society estimates the risk of developing breast cancer is 1 in 8. So lo que estamos diciendo aquí que una de cada 8 mujeres va a desarrollar el cáncer de seno a un tiempo en su vida. Okay, so 1 in 8 women will develop breast cancer sometime in their life. So we have some breast cancer risks. Los riesgos de desarrollar el cáncer de seno son, la primera, the first number 1 risk of developing breast cancer is being a female. Siendo mujer es el riesgo más grande que uno puede desarrollar el cáncer de seno. So everybody in this room, congratulations, we are all at risk for breast cancer. The second greatest risk of developing breast cancer is our age. The older you get, the higher the risk. So, en la edad, en más edad tiene uno, más el riesgo de cáncer de seno. Genetic predisposition. Okay, so about 5 to 10% of breast cancers are hereditary. This is caused by an inherited mutation in the genes called BRCA1, BRCA2 for short. The risk of breast cancer is in the same whether the gene is coming from the father or the mother. So let me just explain to you a little bit about this gene mutation. Does anybody in here know about Angelina Jolie? Anybody know who she is? Okay, so her mother had ovarian cancer, and unfortunately she passed away. So Angelina, she has 6 kids. So she took this test, the BRCA1, BRCA2, to see if she carries that gene. If she does, sometime in her life, she will develop either breast or ovarian cancer. So she took the test, it was positive. So she took the initiative to go ahead and get a double mastectomy and a total hysterectomy just to protect her. So this is what it's all about. El cáncer de seno a veces uno es heredado y tenemos un gene que está en nuestro cuerpo que puede... So hay un examen donde uno puede tomar este examen del BRCA1/2 para saber si usted tiene ese gene que puede desarrollar el cáncer de seno o el cáncer de ovario. Es muy común que todos toman este examen, es muy fácil, cuesta como $100 y pueden ver si usted lleva ese gene en su cuerpo. Personal history. So the personal history of breast cancer or any other cancers, a woman with breast cancer in one breast has a greater risk of developing cancer in the opposite breast. So si usted o alguien que conoce tiene cáncer de seno, el riesgo es un poquito más grande que el cáncer puede regresar en el otro seno. Okay. So we're going to talk about family history now. History of breast cancer in the first-degree relative. So having a first-degree relative is a mother, sister, or daughter with breast cancer approximately doubles the risk. So si usted tiene alguien como su madre, su hermana o su hija con cáncer de seno, el riesgo se aumentó un poquito más. Okay? El cáncer de seno, el riesgo aumenta cuando alguien en su familia tiene edad antes de 50. So the risk of breast cancer increases when your family member has breast cancer from 50 and younger. It's just the risk is a little bit higher. However, only 15% of women develop cancer with family history. This is really important. This is the key right here. This means that 85% of women that have no family history whatsoever can develop breast cancer. And I'm just going to tell you just a little background with my family. As some of you might know, my mother is a breast cancer survivor. She's the only person in our family that had breast cancer. So 85% of women with breast cancer have no family history at all whatsoever. Las mujeres, 85% de mujeres que tienen cáncer de seno no tienen nadie en su familia con cáncer de seno. So es muy común. Porque a veces tengo pacientes que me dicen, oh no, señorita, yo no tengo nadie en mi familia con cáncer de seno, so yo sé que yo no tengo nada. Eso no es la cosa. Uno no tiene que tener cáncer de seno en su familia para desarrollar el cáncer de seno. Okay, excited. So then we have minor breast cancer risks. These are the minor risk cancers of breast cancer. We talked about the major risk, which is being a female, and the age and personal history and family history. Now we're going to talk about the minor risks. So nulliparity means that somebody that's never carried a pregnancy, somebody that's never been pregnant, has a higher risk in developing breast cancer. Esto dice que alguien que nunca ha estado embarazada como yo tengo mis 40 años, yo nunca he estado embarazada, so el riesgo para mí para desarrollar el cáncer de seno es más grande. Okay? Prematurity is becoming pregnant for the first time in a later childbearing age. So when you are pregnant after 30 or 35, your increase of breast cancer or the risk of breast cancer increases. So cuando uno tiene los 30 años y luego tienen hijos, o 35 años, el riesgo es más grande para desarrollar el cáncer de seno. Okay. Menstrual history. This is another one that's a big one for me. So women who start menstruating at an early age, like before 12 years old, there's a lot of little girls right now that are getting their period at 9, 10. That's what it's talking about. And then women that are in menopause after 55 have an increased risk of developing breast cancer because the longer you are menstruating, the longer you are on your menstrual cycle, the higher the risk. Esto está diciendo que las niñas que están con su primer menstrual a los 9, 8 años, 10, 11, tienen el riesgo más grande para desarrollar cáncer en el seno. Y las mujeres que tienen la menopausa después de los 55 años también. So, cuando una mujer tiene la menstruación con muchos más años, más el riesgo. Okay? So hormone replacement therapy. Estrogen and progesterone in the ovaries are important. They're important hormones to regulate the cycle, the menstrual cycle, and pregnancy. As women age, the ovaries begin to shrink and the levels of estrogen and progesterone in the body fluctuate, called perimenopause, which can last for many years. Recent studies have found an increased risk of developing breast cancer in women taking hormone replacement therapy. So for women that are already in perimenopause or in menopause and you have your hot flashes and all that stuff, sweaty, night sweats, and your doctor wants to prescribe you some Prempro or something like that, studies have shown that it does increase the risk of breast cancer. So that's the hormone replacement. Las hormonas, cuando una mujer está pasando por la menopausa, a veces uno tiene, suda, le da mucho calor y ya no pueden, a veces le quitan la matriz o los ovarios y el doctor le receta hormonas y le receta una pastilla para reemplazar esas hormonas. Y a veces hay estudios que dicen que con esas pastillas el cáncer de seno, el riesgo es más alto con eso. Okay. So, what can I do to reduce the risk of breast cancer? ¿Qué puedo hacer yo para reducir el riesgo de cáncer de seno? First of all, alcohol consumption. The more alcohol you drink, studies have shown, the more higher of a risk you are of developing breast cancer. A lot of physicians say, oh, you know, drink 1 glass of red wine a day to help your heart. Well, it kind of doesn't really, it is for the heart, but not for the breast. And studies have shown that the equivalent of 2 drinks a day may increase the risk of breast cancer by 21%. That's a high number. So cuando uno bebe alcohol, es más el riesgo de cáncer de seno cuando uno bebe alcohol. Okay? Don't smoke. Accumulating evidence suggests a link between smoking and breast cancer risk. Not smoking is one of the best things you can do for your health in all aspects, not just breast cancer, in everything. Control your weight. Being overweight or obese increases the risk of breast cancer. Mantener un peso regular. Cuando uno está sobrepeso, el riesgo es más grande. Exercise. Women who get regular exercise have a lower risk of breast cancer. Cuando uno hace ejercicios, eso va a minimar el riesgo de cáncer de seno. Breastfeeding. Breastfeeding really reduces the risk of breast cancer. It's a really good thing to breastfeed. Cuando uno da pecho a su niño, a su niña, reduce el riesgo de cáncer de seno. Avoid exposure to radiation. This is another good one, a good key. And what I do see a lot in women is that they have their cell phone. Does anybody have their cell phone? And they put it in their bra. It's okay, Araceli. A lot of people do that. You get a lot of radiation from your cell phone, and a lot of people don't understand that that is bad, and they're putting it in their bra. Sometimes we get more radiation by flying, being in an airplane, because the closer you are to the sun, the more radiation you get. So try to avoid radiation. So we're going to talk about breast self-exams. This is really, really important. I really stress this out to my patients. So a breast self-examination is just a physical exam of the breast performed by yourself, okay, by oneself. It should be done when you are 18 to 20 years old. And I know everybody in this room is over 18 or 20 years old. So you should always do your breast self-exams once a month. Very, very important. Lo que estoy diciendo es cuando uno se hace la prueba de seno, cuando uno se chequea cada mes. Uno se debe revisar los senos cada mes. Si usted tiene 18 o 20 años y mayor, se debe de revisar los senos cada mes. Una vez por mes. Okay? So it's very easy. It's not hard at all for a breast self-examination. You just want to go ahead and look at the mirror. You want to put your hands on your hips. Just look at your breasts. Make sure that they look the same. That's what you want to see. You want the breast to look the same. You want to lift your arms up. You want to raise them up to see if there's any changes. When you raise your arm up, both breasts should raise together. When they come down, they should come down together. Make sure that they mirror each other. Then you want to go ahead and lay down and feel for your breast. And you always want to go to your axilla, on your armpit. And you also want to do it standing up and laying down, both. If you do just one, that defeats the purpose. You have to do both. So, señoras, lo que estoy diciendo es cuando usted se quiere revisar los senos, hazlo enfrente del espejo. Pon sus manos en sus caderas y mire cómo se ve los senos. Debe de mirarse igual. Y luego levanta las manos. Los senos se deben de ir para arriba y luego cuando baje las manos para abajo, todo tiene que ser igual. Si usted mira algo diferente, que el izquierdo es diferente que la derecha o viceversa, llámale al doctor. Y luego cuando usted se revise los senos, tiene que estar acostada y parada. No importa cuál es primero, pero tiene que ser parada y acostada. Next slide. So this is what you want to look for when you do your breast self-examination. You want to look for a hard lump on your breast. Does it move? Is it hard? You want to look for a rash. You want to look for nipple discharge. You want to look for if your nipple is inverted. What that means is when your nipple is sucked in. You want to look for some flakiness around your nipple, any little type of rash, any dimpling of the skin. Lo que usted quiere ver en el seno es si hay una bolita. Si le está saliendo secreción en el pezón, si está con comezón, si está rojo, si está inflamado, esas son las señales que usted quiere ver, bueno, no que usted quiere ver, pero lo que usted quiere revisar si tiene. ¿Okay? So, yo sé que las imágenes no se pueden ver tan bien aquí, pero esto es lo que usted debe de ver. Algo en su pezón, un poquito de arruga, algo rojo, inflamado. Tenga eso en mente. Next slide. También cuando algo está saliendo de su pezón. Cuando usted se revise los senos, usted quiere apretar un poquito el pezón. Y si algo sale que es claro, como aquí, es una señal de cáncer de seno. When you do your breast self-exam, you always want to just pinch a little bit your nipple, just to see if something comes out. Don't try to squeeze so hard that you want to make something come out. Just a little bit of pressure. And if it's clear, this is a sign. Okay, so I just wanted to show you this picture. It's a clear discharge. It's only one breast. Always go to your doctor. No le dé pena ir con su doctor cuando usted ve unos señales así. Uno quiere ir al doctor temprano y no más tarde. You don't want to hesitate and not go and get checked. Don't let it pass by month after month, year after year. You want to go ahead and get checked and just have some peace of mind. Go get it checked. It might not be anything, but you want to go ahead and get checked. This is a nipple inversion. I know you can't see the picture really well, but the nipple is inverted, and sometimes it's normal. Some people are born with the nipples inverted. Sometimes when you're pregnant and the nipple will invert, ask your doctor. But when somebody comes in to our facility with a nipple inversion and it's just out of the blue sky, sometimes that cancer is just sucking that nipple in. So, cuando el pezón está metido para adentro, esa es una señal. A veces nacemos, las mujeres nacemos con los senos así. A veces es normal cuando uno está embarazado o está tratando de dar pecho. Pero si usted mire de un día a otro, un mes a otro, que su pezón está metido para adentro, ve con su doctor. A lo mejor es algo. ¿Okay? So, aquí está, el seno está inflamado. Está muy rojo. You don't want to get to this point. You want to make sure that you go to the doctor. And we have a lot of patients that they just like, oh, well, it's just a rash. I'm scared. I don't want to go. Try not to let it get to this point because this is inflammation. It's redness. It's hot. That can be breast cancer, inflammation of breast cancer. And there's 14 types of breast cancers. And not every breast cancer is treated the same. Hay 14 tipos de cáncer de seno. Y este es uno. Go ahead. Okay, so this right here is a rash. This is actually a yeast infection. And it's normal to get yeast infections under the breast. Sometimes patients with bigger breasts, and it's hot outside. This is Houston. The humidity, you sweat, and sometimes it can look like this. That's normal, but go to your doctor anyways. Get it treated. Esta es una infección. Y a veces no es cáncer, es nomás una infección, una mancha en el seno, pero como quiera, vaya con el doctor. No esté tímida, no le dé pena. Ve con el doctor para que le recete unas cremas o algo para la infección. Okay? And this is the last one. I know it's kind of not a pretty picture, but this is a type of cancer and she let it go way too much. Don't let it get like this. Okay? Go to your doctor with any little signs. When you do your self-breath examinations every month, that's what you want to look for. You want to look for any flakiness around your nipple, around the areola. Make sure it doesn't get to this point. Este es un tipo de cáncer de seno y como estoy diciendo, no se la toma a la ligera. Ve con su doctor. Cuando usted ve algo así, ve con el doctor. Okay? So now we're going to talk about a clinical breast self-examination. We already talked about the self-breast exam. Now we're going to talk about the clinical breast examination. So it's just a physical exam of the breast performed by a health profession. And you want to start doing this at the age of 20 and up. And again, we are all over the age of 20. you want to get your breast checked by a physician every year. Okay, so first you're going to do your breast self-exam once a month. Then you're going to get your breast checked by a doctor once a year. Este es un examen que el doctor le revisa los senos cada año. Todos debemos o todas debemos de revisar los senos una vez por mes y luego una vez por año por un doctor. Okay, next slide. Now we're going to talk about a mammogram. Okay, so a mammogram is a safe low-dose x-ray of the breast. A lot of people, a lot of patients, they tell me, oh, you know, it's too much radiation, I'm going to get breast cancer. No, you're not going to get breast cancer by having a mammogram. It's a really, really low, safe dose x-ray. I think you probably get more radiation from your phone than you will from a mammogram. It's the most effective method detecting breast cancer at its earliest stage. Go ahead. So the American Cancer Society recommends women beginning at the age of 40 to get their mammogram. I'm 40, but I've been getting my mammograms since I was 35 because my mother is a breast cancer survivor. So at 40, the American Cancer Society recommends once a year at the age of 40. However, if you're under 40 and you're experiencing some problems on your breast, you want to go to the doctor and get checked, and then we'll just go from there, okay? Don't let it go by, oh, I'm not 40 yet, I don't need to get a mammogram. No, you need to go to your doctor and get checked first. Cada año, las mujeres que tienen 40 años para arriba, se debe de hacer, o es recomendado, de hacer la mamografía cada año. Ahora, si alguien en su familia o una compañera del trabajo no tiene los 40 años y está teniendo problemas con los senos y tiene 40 y menos, debe ir con el doctor para que se le revisen los senos, pero cada año. So, tenemos tres cosas: revisar los senos una vez por mes, ir con el doctor para que nos revise los senos una vez por año, y luego a los 40 hasta que nos moramos, la mamografía cada año. So there's three things that you need to do: your self-breast exam once a month, your clinical breast exam by a physician once a year, and then your mammogram once a year from 40 and up. Next slide. So this is a mammogram. A lot of people don't know or haven't had a mammogram. This is what it is. This is the machine. This is the paddle, and it compresses the breast, and it takes an x-ray of the breast. Eso es lo que es una mamografía. See, how many have ever had a mammogram? Everybody, so y'all know how it works. Okay, next slide. So we're just getting the breast into the machine, we compress it, we take the picture, and yes, it's a little bit uncomfortable. Yes, it hurts for a couple of seconds, but this can save your life. Sé que la mamografía no es cómodo, duele, pero es nomás por unos cuantos segundos. Esto puede salvar su vida. Okay, next picture. So a lot of people ask me, Jennifer, how do you do a mammogram on a man? Same as a woman. A veces las pacientes me preguntan, ¿cómo le haces la mamografía en un hombre? Lo mismo que una mujer, es la misma cosa. Because men do get breast cancer, okay, not just women. For 100 women, 1 man will get a breast cancer. In the 7 years that I've been doing mammograms, I've had 5 male patients with breast cancer. It's not that common, but it does happen. And I actually had a patient yesterday that her nephew died of breast cancer at the age of 30. Okay, next slide. So there's a lot of treatments out there for breast cancer. We have surgery, radiation therapy, chemotherapy, hormone therapy. A lot of people, when they say breast cancer, they automatically think death. But there's treatment options. That's why you want to catch it early. That's why you want to do your breast self-exam. That's why you want to go to your doctor and get checked once a year. That's why you want to get your mammograms. Because if you do have breast cancer, we want to catch it at an early stage. That way you have options. And the survival rate is awesome right now. Okay? So, cuando usted, señora, cuando tiene un problema y va con el doctor, se revise los senos usted misma, va con el doctor y le revise los senos, le hace la mamografía y encontramos algo, queremos encontrar ese cáncer bien pequeño para que usted tenga opciones como cirugía, radiación terapia, la quimioterapia, la terapia con hormonas. Eso es nuestro gol, eso es nuestra meta, que si usted, Dios no quiera, pero si usted desarrolla el cáncer de seno en un momento u otro, lo queremos pescar in a very early stage, en una manera muy temprana, para que usted tenga opciones. Y hay opciones, okay? So breast cancer does not discriminate by cup size. So it doesn't matter what cup you are, breast cancer doesn't discriminate. El cáncer de seno no discrimina. Al cáncer de seno no le importa qué copa es usted. A, B, C, D. Yesterday I had a patient, she was cup K. The largest I've done was cup L. It doesn't matter. Breast cancer doesn't care. So this is one of my really good friends. Her name is Kathy. And her mother died of breast cancer at the age of 28. She was only 10 years old when her mother passed. Es mi amiga. Su mamá de ella se murió de cáncer de seno a la edad de 28 años. Ella nomás tenía 10 años. Okay, next slide. This is Patti. Patti's from the Valley. She passed away of breast cancer as well. She left her son, 5 years old. She was about 41. Esta es Patti. Ella tenía la edad de 42 años. Dejó su niño de 5 años. Ella falleció de cáncer de seno. Next slide. And for everybody that knows, that's my mother. She's a breast cancer survivor. And she's, yes, 14 years of breast cancer survivor. And I'm going to tell you a little bit about her story really quick. I know we have a couple of more minutes. So my mom has always been faithful with her mammograms. Every year, she never missed. And she was 35. Right now, she's 68. But there was a time back in 2004, she did her mammogram like she always did. It came out normal. Everything was fine. 3 months later, she went to her gynecologist and he checked her breasts. Everything was great. A couple of months later, she was having some other kind of issues, not with the breast, but something else in her body. So she went to the doctor. And it just so happened that her doctor said, Ms. Rodriguez, go ahead and lay down. I'm going to go ahead and check your breast. So he checked her breast and he found a lump. And he said, I don't know what this is. Let's go ahead and get a biopsy on it because I'm not really too sure if it's cancer or not, but to be 100% sure, let's go ahead and biopsy it. They biopsied it and it became stage 3 invasive ductal carcinoma. So she was not even due for her mammogram yet. She needed 4 more months for her yearly mammogram. And she was already at stage 3. That's why it's so important to check your breast every month, to get checked by your doctor, and to get your mammogram. If she would have waited for her yearly mammogram, she probably wouldn't be with us right now. She would probably have metastatic breast cancer stage 4. But thank God that she went to her physician, he checked her, found the lump, she got treated, she got radiation therapy, she got chemotherapy for 1 year, and now she's a survivor. Thank the Lord. Nomás les quiero explicar, señoras que están aquí, ella es mi madre, ella trabaja aquí, ella siempre fue fiel en sus mamografías de los 35 años. Cada año se hacía la mamografía, cada año su doctor le revisaba los senos, pero había un año que se hizo la mamografía, todo salió normal. Fue con su doctor, le revisó los senos, todo normal. Y luego unos meses después, mi mamá fue con otro doctor por otro problema que tiene nada que ver con los senos. Y el doctor le dijo, señora Rodríguez, acuéstase, le quiero revisar los senos, nomás para revisar. Le revisó el seno, le encontró una bolita en el lado izquierdo. El doctor se preocupó, dijo, no sé si es cáncer o no, pero para asegurarnos, vamos a hacer una biopsia. So, le hicieron la biopsia y era cáncer de seno estado 3. Tenía que ser radiación terapia, quimioterapia por 1 año y el cáncer era muy, muy agresivo. y todavía no le tocaba hacerse la mamografía, porque la mamografía antes estaba normal. 8 meses después tenía el cáncer de seno. So, tengo muchos pacientes que me dicen, oh, no, señor, porque así me dicen, no, señor, todo está bien, yo sé que todo está bien, yo no tengo nadie en mi familia que tiene cáncer de seno, yo me reviso todos los días, mi mamografía el año pasado fue normal, so, creo que no voy a ir este año o voy a venir en 2 años. Vienen y algo está allí. Es mejor hacerse la mamografía, revisar los senos e ir con el doctor. I have a lot of patients that tell me, you know what, no, I'm not going to come this year. I'm not going to come next year. I think I'm going to skip 5 years. It hurts. It's uncomfortable. I'm scared. What if they find something? Well, if they find something, you want to find it early because there's treatment options. With my mom, they found her breast cancer 8 months after her normal mammogram. And it was stage 3. It was so aggressive that the doctor had to give her 1 year of chemo. 1 year, 12 months. It was so aggressive. If she would have waited and not go to the doctor and would have waited for her yearly mammogram 4 months later, she would not be here with us today. So it's very important. I know sometimes it's scary. You kind of get, oh, I'm scared. You get timid, like, oh, I don't want to tell the doctor I feel something. Get a female doctor. You know, if you're not comfortable with a male doctor, get a female doctor. That's what I do, you know. And I have to take more precautions because 1, I'm a female. 2, I'm getting older. 3, my mom had breast cancer. 4, I've never been pregnant. 5, I'm still menstruating. So I have 5 things going against me. So I need to take my precautions. I check my breast almost every day instead of once a month because I get that nervousness. I get that fear. And I do this every day and I see it every day. And there's just so many women getting younger and younger with breast cancer. A lot of my patients, they ask me, do patients that are pregnant get breast cancer? Yes, they do. We see a lot of women, and actually it's been kind of common now, a lot of women that are pregnant get breast cancer. Hay muchas mujeres que están embarazadas que desarrollan el cáncer de seno. Es algo común, no es algo raro, es algo que pasa. Y estamos viendo que hay muchas mujeres ya en los 20s, en los 30s, que están desarrollando el cáncer de seno. So, es mejor usar precauciones, revisar los senos, hacerse la mamografía, no le dé pena, vaya, es para su bien. Ustedes tienen hijos, ustedes son madres, abuelas. Su familia los quiere aquí. You have family, I'm pretty sure you have children, grandchildren, you have your parents. They don't want to see you gone. Get your mammogram. Check your breasts. Go to your doctor. Don't be scared. With any little thing, go. If you're not sure, go to your doctor. Make your appointment. So with this, I leave you. I thank you for coming and listening to my lecture. I just want to encourage everybody to go out and get your mammogram. Tell everybody that it's important. This is October. It's Breast Cancer Awareness Month. So let's go and get our mammograms.